Hi, this is Katie with Alpine Rescue Team. Today I'm going to be talking to you about burns. The first thing I want to talk about are the classifications of burns, first of which would be chemical, which is caused by a chemical reaction between substance and the skin. First, the main thing to think about with your chemical burns is stopping the burning process, which may involve removing the chemical, rinsing with copious amounts of water, and also remembering, most importantly, to protect yourself with your BSI and making sure that you don't become contaminated along with your victim. Second type of burn to think about is a thermal burn, usually caused by a heat source. In that case, your job is to stop the burning process, whether that means removing the victim from the heat source or stopping the burning process by cooling the burn in some way. For example, if your victim's on fire. The third type is your radiation burn, which we would commonly think of which our most common cause is probably from the sun here in Colorado. We're going to use Sabrina as our victim and say that she has burned both palms of her hands. I've already completed my primary and secondary survey, so I'm moving forward to just treating her injuries. And when she was reaching to grab something off the fire, she burned both palms of her hands. Regardless of the type of burn that you see, the treatment is going to be pretty much the same. It's going to be stop the burning process, and then keeping the wound clean and dry, and managing your victim's injuries. In this case, just the palms of her hands are involved. The palm of your hand is approximately 1% of your total body surface area. You can also see in your book the rule of nines. If you want to estimate how large a burn is, that's a good way of estimating either the palm or the hand or the rule of nines. Other things that I would be concerned about if Sabrina had a critical burn is if she had burns in her face or anything involving her airway, especially a hoarse voice, which could be a clue to me that she could be having some airway compromise secondary to her burn. Also, burns that involve the hands and the feet are also a critical burn because those are areas of high function and you want to take very good care of them. If I'm looking at the palms of her hands, I see that they're red, they're blistered, they're painful. She's amazingly patient. And so my treatment for these, she had already, before we got here, dunked her hands in cool water. So she stopped the burning process. My job now is just to treat her wounds. And I'm just going to treat those by applying a dry, sterile dressing and wrapping. With larger burns, or a lot of people have the instinct that you want to put something on a burn, and a lot of times that's not the best treatment. If you don't have a clean sterile dressing, a clean dry dressing will work just fine. Please don't use water because that can, especially in larger burns, actually induce hypothermia because your burn victim can't thermoregulate, can't regulate their body temperature just because of that loss of skin. And in my job when I'm not volunteering here at Alpine, I'm a burn nurse, and so having worked in that field for a long time, the big things that I see that first responders can do are making sure that you dress those burns appropriately, those dry, clean dressings. If you don't have dressings, sterile, clean sheets work just fine. Making sure that you remove all jewelry. If Sabrina had rings on, it would be invaluable that those rings come off so her fingers don't swell and have the risk of that ring turning into a tourniquet. And additionally, just watching your victim's airway and temperature and making sure that you support both of those and help manage their pain. And I think that's about it on burns today.